because look how many people I have in front of me now. Look how many people I get to talk about metabolism and nutrition. Look how many people I get to tell you how I feel as a physician who's been around a while about what this does for you and your health. Yes, I know a little bit about the skin products. I do. You can ask me a little bit about the skin products. I'll give you some of the science. I'll point in the direction of the people who are smarter than I am, the people who have more knowledge on these products. I can point that direction. But what am I focused on? Why am I here? I'm here because I can affect this many people. Now let's say, how many people are in the room? Let's say 30. There are 30 people in the room. Let's say only one person in this room wants to learn more from me, from my staff, from those around her, from my mentors about this. Well then, that's one more than before. How many appointments is this for me at the clinic? That's 30 appointments. So in 1 hour, I get to pass on this information, and I get to pass on, and 1, 2, 3, 4 of you may want to take it a little further. And it's that many more people I can affect as an individual. That's that many more people you can affect as an individual. The physicians have a challenge here. And this is, and actually, can you go ahead a few slides? I'm going to keep going, keep going, keep going, keep going. There's a very particular slide I'm looking for. Keep going. Oh, tell me I didn't do that. Keep going. Keep going. More ways for doctors to make money. This is a title of targeting doctors. A lot of doctors are challenged in this economy, in their clinic, with lower reimbursements and less time to take care of you, the patient, and patients asking for that single bullet. We don't have that single magic bullet. We don't have that single pill that fix all your problems. So there's these challenges that doctors have. And some of you in this room are in that position, where you are seeing patients. I know some of you, we've got some clinical nutritionists in here, we've got some dietitians in this room now, and we've got some healthcare providers that walked in. You know the challenges. So this is an actual report targeting me about ways for doctors to make more money. These are suggestions that other colleagues are making to me, the doctor. You're going to love this. Ready? Go. So teach more students. Okay, great. I can teach more students. Wonderful. Work in a prison. They're suggesting to me to go work in a prison, which is okay. I don't mind. I've done it before. It's okay. Supervise PAs and NPs. Serve as an expert witness against other doctors. Well, that's going to go over really well with my colleagues. Review health insurance claims. I love paperwork. Poke me in the eye. Next. 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 You push them forward. Oh, there's a whole bunch more, but do you get the idea? I'm working.
Here we go.
I'm working 60, 70 hours a week. My clinic's open on Saturday. I actually go into my clinic on Sunday, don't I, honey? On Sunday. Why do I go on Sunday? I'm not here to see patients. Why? Paperwork, insurance. I just wrote a blog. On that same blog, you'll see a thing that what did I say? I forgot the title of it. But I talk about what happened to me last week with paperwork. Just last week, I wrote the blog. Read it. Because I sat one evening, instead of picking up my son and going with my wife and picking up my son at his play practice and watching the play practice, I sat in my clinic fighting an insurance company, begging for 2.5 hours. I was begging a person who had no idea what medicine was for a single medication for a patient of mine that would keep her alive. I was begging. Was I getting paid to beg this patient, beg this insurance company? Was I getting paid for the time it took for me to be away from my son and my wife? No. That's not why I was mad, because I do this all the time. I fight insurance companies all the time. I was mad. I shouldn't say mad, but I had this crunching feeling in my chest because the patient had just chewed my staff out, telling my staff she was angry at my staff because it's Dr. Gonzalez's job to talk to the insurance company to beg for my medication. That wasn't the first time I heard that, by the way. I hear that every week. 70 hours, 60 hours on Sundays. On Sundays I'm there because I got to do that paperwork to make sure those insurance claims are done, to make sure those prescriptions are written. And now my colleagues are telling me to work more. Go work in a prison. Or go teach students, which I love to do. Oh, I'm going to work on a cruise ship. Bye, honey. I'm on a cruise. How's that going to go over? Work in a nursing home. These are all great things, and these are all things that are wonderful to do. But if I'm working so much now, if you are working in your job now, and like Todd said earlier, how are you going to make more money? How are you going to earn a living? Well, spend more time. Do I have the time to spend? Do you have the time to spend? We want to get to the point. Why am I standing here? Because I'm trying to make it more efficient for you to get in a better place. I'm trying to gather you to the people, get you to the people that get you in a better place, not only financially, but health-wise. And that's why I'm here. If you don't understand the value of this after today, after what I said this morning, we need to talk. Come see me. Make an appointment in my clinic. Come see me. I'm more than happy to spend the time to talk to you. And if I'm willing to fight for a drug that a patient has been on for 4 years that the insurance company says you can't have now, but it keeps her alive, but you can't have it now, so she has to pay $500, $600. She's been paying $500, $600 a month for the last 4 months for this drug. One single drug. If I'm willing to do that, don't you think I'd be willing to help you? Absolutely. You've got 3 people here that have helped hundreds of thousands of individuals on the financial side of things, hundreds of thousands of people. And look, they're standing here with me. I didn't ask them to come. Thank you, by the way, appreciate it. Thank you very much. I didn't ask them to come. But these are the individuals you get to talk to. And that's why I'm here, to tie that on together. So I encourage you to talk to the individuals that brought you here. On our team, we focus on the nutrition side of things. We focus on the supplements, but we also have people on the team that focus on one single product. They focus on one skin product. They focus on why. Well, Todd told you a little earlier ago, I get approached by all sorts of companies, all sorts of vendors, all the time. Dr. Gonzalez, this is the best ever. My wife, she's a businesswoman. She has a salon. She gets approached all the time. We have the best anti-aging cream ever, Dr. Gonzalez, because we're the #1 in the world with our best anti-aging cream. Okay, what makes it best? Well, our scientist said so. What scientist? Well, this scientist here. Okay, so I talked to that scientist. He doesn't remember that he was part of that company. Oh, yeah, I remember now. Yeah, that was that study that they did a long time ago. They said that this one ingredient that's in the cream helps a rat skin get better, I think. I can't remember. Let me look into it. That actually was a conversation I had with a scientist at a company and a vendor that came to me 3 years ago. That was an actual conversation. You know that guy, that white coat doctor, stands in front of you, and that magazine that you read says, take this product, Hydroxycut. I'm a doctor. It'll help you lose weight. And got a good-looking guy, white coat, and it says intern. Do you know what an intern is? It does. He's a doctor. He's got it all official. Do you know what an intern is? An intern is a brand new physician right out of medical school who the very first day out of medical school walks out and sees you for the first time. You're his first patient ever, and you're asking him to take care of your physiology, your function, how your heart is doing, and what the brain is going on with the gut. And did you know that the gut is part of your immune system that's tied with the hypothalamus? That's the guy you're getting advice from. Marketing, Hydroxycut. Take Hydroxycut for a little while and see what happens. You're getting good advice from good people who are knowledgeable in business. I have no clue about business. You know what the best thing that ever happened to my clinic, business-wise? The best thing that ever happened to my clinic, business-wise, was my wife. Why? Because here I am. I hired people, like, I don't know, I'm focused on the medicine, I'm here writing prescriptions, and she knows how to step back and say, did you know that employees should be doing this, and that you should have, and that your revenue should be doing, and I have no clue. Just let it handle on its own. Here in this room, we have people who know how to manage Todd over there, who knows how to manage this system. He's approached more doctors on this standard than anyone I've ever known, including the person that brought me in, including Dr. Steve Moore who brought me in, who it took him 18 months after he introduced this to me, 18 months for me to pick up the phone. Remember the guy that says, I'm busy? That was me. I'm busy. 18 months I did that to Dr. Steve Moore. I'm too busy. And then he says the words antioxidant and Mark Bartlett, Dr. Mark Bartlett. Anybody know who Mark Bartlett is? Mm-hmm. Dr. Mark Bartlett was somebody that I worked with a long time ago at NIH and antioxidant research. When I say work with him, it sounds like really. This is Mark Bartlett, and here's me, right here as a doctor starting out. A little more than an intern doing research. But I knew who he was. And it didn't make sense to me because Nuskin was Avon and Mary Kay. That's what it was. Nuskin was Avon and Mary Kay. That's what it was to me. But he said antioxidant. And then he said scanner. And then he said University of Utah. Then he said Raman spectroscopy. And then he said Mark Bartlett. And I thought, Mark Bartlett, he sold out. I can't believe one of my mentors sold out. He sold his name. He was that doctor in the white coat saying, hi, just take my Avon and Mary Kay. But it confused me because I knew him better than that. And so I called him and said, Mark, what's going on? Why'd you sell out? I said, sell out? He said, do you know who Dr. Joe Chang is? I said, no. And he goes, yes, you do. He goes, do you know the drug Rapamune? Oh, yeah, I put patients, I got a lot of my kidney patients, my renal transplant patients on. He said, well, he designed that drug. He's my boss at Nuskin. So that's when I paid attention. And then he starts naming more people. Dr. Nags, Dr. Mastelaus, Mark Wood, and on and on and on. And he kept going. These are names that I knew in textbooks that I studied, in the things that I do when I advise my patients. And then he kept going. 75 of these types of scientists. And so I had to pay attention. And then that's when I realized, oh, you mean the guys that write all the nutrition books? Our farm mix, Nuskin, really? Are you kidding me? Stanford, Yale, all these people? That's when I paid attention. And that's why I'm standing in front of you. And if you're not paying attention after today, it's okay. It's okay. But I promise, if you pay attention to these smart people that are in this room, then you'll be in a better place tomorrow. Have a good day.